Hello friends, welcome to Nursing Guide. Today we are going to discuss about RRB exam MCQs. Our first question is the organism most commonly responsible for cholecystitis is option A meningococci, option B Klebsiella, option C staphylococcus, option D pneumococci. And the correct answer is option C staphylococci. The organism most commonly responsible for cholecystitis is staphylococci. Next, one of the major causes of cirrhosis of liver is option A alcohol abuse, option B drug abuse, option C smoking, option D hepatitis A. And the correct answer is option A alcohol abuse. One of the major causes of cirrhosis of liver is alcohol abuse. Next, as compared to diverticulitis, is a patient with diverticulosis has option A rectal bleeding, option B no symptom, option C localized cramping pain, option D abdominal distension. And the correct answer is option B no symptoms. As compared to diverticulitis, a patient with diverticulosis has no symptoms. An abnormal sac or pouch formed at a weak point in the wall of the alimentary tract is option A aneurysm, option B diverticulum, option C hernia, option D protrusion. And the correct answer is option B diverticulum. An abnormal sac or pouch formed at a weak point in the wall of the alimentary tract is diverticulum. Next, which of the following is the appropriate diet plan for the first 24 hours for a patient with active upper GI bleeding? Option A NPO nothing by mouth, option B regular diet, option C bland diet, option D clear liquid. And the correct answer is NPO nothing by mouth is the appropriate diet plan for the first 24 hours for a patient with active upper gastrointestinal bleeding. Next, if the IQ of a child is 45, in which category of mental retardation will he be categorized? Option A mild mental retardation, option B moderate mental retardation, option C severe mental retardation, option D profound mental retardation. And the correct answer is option B moderate mental retardation. If the IQ of the child is 45, moderate mental retardation present in the child. Next, which of the following is considered a risk factor for nosocomial infection? Option A acute hydration, option B prolonged hospital stay, option C regular exercise, option D proper nutrition. And the correct answer is option B prolonged hospital stay. Prolonged hospital stay is considered a risk factor for nosocomial infection. Next, what is the management of persistent hiccups? Option A ask the person to drink water, option B administer 3 to 10% carbon dioxide, option C ask the person to walk in an open space, option D all of the above. And the correct answer is option B administer 3 to 10% carbon dioxide. Administer 3 to 10% carbon dioxide is the management of persistent hiccups. Next, nursing measure for a patient complaining of difficulty with micturition include option A sound of running water, option B stroking the inner thigh, option C pure lukewarm water over the perineum, option D all of the above. The correct answer is option D all of the above. The nursing management for a patient complaining of difficulty with micturition include sound of running water, stroking the inner thigh, pure lukewarm water over the perineum, All of this. Next, the nurse inserting a Ryle's tube for an adult patient is aware that the distance between the incisor teeth and the gastroesophageal junction is option A 20 cm, option B 30 cm, option C 40 cm, and option D 50 cm. And the correct answer is option C 40 cm. Next, the recommended duration for completing suctioning of a tracheostomy tube is option A 5 to 10 seconds, option B 10 to 20 seconds, option C 20 to 30 seconds, and option D 30 to 45 seconds. The correct answer is option B 10 to 20 seconds. The recommended duration for completing suction of the tracheostomy tube is 10 to 20 seconds. Next, the most important concern while providing oral care to an unconscious patient is option A. Use ordered mouth care solution, option B. Preventing aspiration, option C. Look for denture, option D. Provide oral care in each shift. The correct answer is option B. Preventing aspiration. Preventing aspiration is the most important concern while providing oral care to an unconscious client. Next, after a surgical procedure, stroking are usually used to option A. Prevent varicose veins, option B. Promote venous return to the heart, option C. Prevent muscular atrophy, option D. All of the above. The correct answer is option B. Promote venous return to the heart. Promote venous return to the heart. After a surgical procedure, stroking are the usually used to promote venous return to the heart. Next, post-operative respiratory complications can be prevented by option A. Deep breathing, option B. Coughing exercise, option C. Intensive spirometry, option D. All of this. The correct answer is option D. All of this. Post-operative respiratory complications can be prevented by deep breathing, coughing exercise, intensive spirometry. Next, the umbilical cord contain option A. One artery and one vein, option B. One artery and two vein, option C. Two arteries and one vein, option D. Two arteries and two veins. The correct answer is option C. Two arteries and one vein is the umbilical cord contains. Next, which vein should be used first when initiating IV therapy? Option A. Jugular vein, option B. Basilic vein, option C. Branchiocephalic vein, option D. Axillary vein. The correct answer is option C. Branchiocephalic vein. Branchiocephalic vein should be used first when initiating IV therapy. Thank you for watching. Do like, share and subscribe.